Hey guys, welcome back to my channel. Last time we talked about the defibrillator and I hope you guys learned a lot from that section. Today, as I promised in my last video, we are going to be talking about the 12-lead ECG. This is a follow-up to the series ALS Ambulance Advantage AAA. So please do me a favor by subscribing to my channel and liking my video. So today we are talking about the ECG and we're going to do it like this. We're going to talk about the definition, we're going to talk about the components of an ECG, and we are going to talk about what you need to have before performing an ECG on a patient. An ECG is actually a painless test you do on your patient to check out the electrical function of the heart. So what you want to explain to your patient is to reassure them that it's painless. Most of the times, because you tell them to expose their body to do this test, they feel that it's going to be a painful test. So you reassure them and you continue the test. So for you to do an ECG, for you to do the test, you have to connect your patient to the ECG machine using an electrode. Okay, so the different components in an ECG machine, you have the machine itself, then you have the buttons, and you have the electrode. So as part of requirement for performing your ECG, you need a gel also, especially for this type of equipment that requires a gel for you to connect to the patient. Other ECG machine has this paper sticker electrode that you can attach to the patient and you can connect it to the patient. But for this particular machine, you are going to use a vacuum type of electrode and a clip type of electrode. So you need a gel to stick firmly to the patient body so that it can get all the readings that you want it to get. So moving over to the button section here, you will find out that there are different buttons. There's a power button here, and there's a freeze button. This freeze button is used when you want to freeze the screen and you want to look at a particular lead very well. There's to cancel. This is to cancel. Then if you want to fill patient details in the machine, you press on this. So once you press on this, it will get you the different option to fill patient ID, date of birth, gender, and pacemaker. So after filling all of those things, then you can press OK. Then you can start your ECG reading. Then this symbol here is to print. So if you are done after freezing your screen and you are done with the reading, you can now click on this and to start printing. If I click on this now, it will start printing for you. So I don't want to waste the paper, so I won't click on it. This is to navigate, to go up and down, and this is enter for the machine. Now moving to the electrode, it's a very simple piece of hardware to connect to the patient. What you want to do in this case, if you count it, you find out that it's 10. If you count them, it's 10. But this 10 electrode is capable of giving you 12-lead ECGs. Most persons get confused when they see 10 electrodes producing 12-lead ECG. It's the machine's process, and that's how the whole thing goes. So in this electrode, you have the chest electrodes, which are vacuum like. So you have to put a gel on the surface here, then press it down before relieving it to attach to the patient body. Then while the limb electrodes are clipped, so you have to clip down on it. So I'm going to leave a graphics on the screen to show us how to attach the electrode to the patient. So once you have gotten all of that, you make sure that the patient do not move while you are taking the reading. This is to avoid artifacts. So you want to minimize artifacts. Other things that can cause artifacts include the interference from electricity from other devices. So you want to make sure that you are minimizing interference either by movement or from the electricity or from other equipment, and you should be able to set your ECG to give you the appropriate reading that you want to get. So once you have gotten it, you can print it out and transmit it and treat your patient accordingly to what you see. So what I usually advise my students is that you treat the patient not the machine. Because most of the times, some people will just see a reading on the screen and judge based on that. You have to match the patient's signs and symptoms to what you are getting from the machine before you can make a diagnosis and actually treat your patient. So I think we have been able to cover some basic stuff about the ECG machine. Any other useful information, I'm going to leave it on the screen. Next time we are going to be talking about the ventilator. So I'm going to talk extensively about the ventilator and ventilator mode. So try as much as possible to subscribe and invite one of your friends to join us and learn together. So till I see you guys next time, remain blessed.